Good afternoon, everyone, and very excited to be here. We've got a fantastic panel today. None of them need any introduction, but Rajan, was with Microsoft, Google, before he moved to PeakXV, a prolific investor. Also runs Search, the Y Combinator equivalent of India. Mr. Anil Agrawal, he obviously launched, this platform. Previously was at DPIIT, the first fund of funds, Startup India moment he kind of seeded. And we have Prashant Warier. Prashant is founder of Qure.ai, a digital health startup built from India, for India, but also for the globe. And I'll have each one of them spend a minute just talking about, what they do and also a bit about the transformation, India's journey to become a product nation. Rajan?
Yeah. Hi, everyone. Thanks for moderating. So I think my only real thought is, deep tech is the final frontier for India's startup ecosystem. I think we've gone from the time that Startup India was launched with Mr. Anil Agrawal's leadership and others. We've gone from sort of not being on the map on global startups to being the third largest startup ecosystem in the world. And in many spaces, India today leads the world, right? If you look at fintech, I would say that our fintech entrepreneurs are better than any other fintech ecosystem in the world. You look at commerce, we're the only country that made quick commerce work. So if you look at new brands, the last new brand that was created in the US was Lululemon, and that was not even American. They were Canadian, right? Whereas in India, you're seeing hundreds of very, very exciting new companies, right? So we've seen sort of this extraordinary surge of innovation of startups in India. And I think the final frontier really is deep tech. It's science-based, research-based innovation. And the way I look at it is we are just getting started. But there's every reason that we will win, right? And it's not a matter of will we win, it's we will win. And I think the question is, how do you make it happen faster? And the reason we'll win is, I think most importantly, look, we have the talent. There's no question we have the talent, right? We have 17 million engineers. We have PhDs in every topic. Now, of course, we'd like to have more. That's number one. I think number two, we increasingly have the markets, right? When you're a $1 trillion economy, you don't have enough of a domestic market. But when you're a $4 trillion economy going to 10 trillion, you have the market. And then I'd say the last thing is we have a very, very supportive government. I think the most recent budget, the 1 lakh crores that was set aside for private sector R&D, idea to lab, commercialization, etc., is just one of the many things that I think India is doing. What started, I guess, 10 years ago is really picking up steam. So I couldn't be more excited about where we're at. I think as a firm, we're very active investors in deep tech, from semiconductor to space to battery recycling to biosciences to AI. I mean, AI, obviously, everybody's investing in. But if you look at non-AI deep tech, so we couldn't be more excited about what's happening in India.
Good afternoon, everyone. I'll start with, remembering the good old days. When we started Startup India in DPIIT, that was in 2016-17. And that was the time when not many in the government and of course outside knew what a startup was. So, when I was assigned this responsibility, I first of all tried to understand what a startup was. And then we gradually built capacities from that level to what is a startup. This was started in Government of India. Then we built capacities across the states through the startup ranking framework, and then created this entire thing. So when we started in 2016-17, there were only 3 states who had a policy to proactively support startups. Today we have 31 states supporting startups as a proactive policy. We started with probably 6,000 startups. Today you have 1,68,000 startups. And in fact, I was looking at numbers only in deep tech space. You have more than 10,000 startups registered with DPIIT. More than 10,000 startups in deep tech space registered with DPIIT. More than 95% of districts now have a startup, at least one startup. The vision of the Prime Minister is to have one startup in every block. Now, that's a huge task for us. But still, you are reaching somewhere, you are at least reaching one startup every district. And over a period of time, what we've seen is tremendous participation of the younger women into the startup ecosystem. It used to be about, 5-6 years ago, we used to say there are about 45% women founders. Today, there are 48% women founders of these enhanced numbers, which means there is a huge increment in number of women participating in this. Another thing that has happened during this period is the digital public infrastructure that has happened unique to India. We've started with Aadhaar, we built up UPI, we built up account aggregators, OKens, we built up ONDC, and these are huge opportunities in this AI world now to develop India-specific, our own regional, cultural specific applications for, creating a huge new market. Finally, I think in terms of policy, you said it yourself. I mean, this is the feeling that makes it more important, that there is a government which is supportive, which is listening and then doing things that it should be doing. So these are probably some of the things to see. I am looking at this event today. Look at the scale of this event. It's the energy that we have here is truly infectious, and this is what gives you even more confidence that we are on the right path.
So we started in 2016 at Qure. What we do is we started doing AI way before it became so popular. In fact, I started doing AI about 25 years ago when there was no field called data science or AI. And at Qure, we build our own completely from scratch foundation models for vision, where we are training algorithms to automatically interpret radiology images from X-rays to CT scans to some ultrasounds. And today we have a portfolio of products which can detect various kinds of diseases on radiology imaging. And we've sort of built end-to-end portfolios for detection on that. So again, when you build these clinical products, you have to get the regulatory clearances. You have to get FDA clearance to sell in the US. In India, we have to get CDSCO. And we have gone and gotten that. We have 18 FDA clearances. And most importantly, we're a very global company. So we're in about 100 countries, solving problems for about 15 to 20 million patients across those countries. And we're in about 4,000 hospitals across those 100 countries. So that is something that we've done, and all of that in the last 4-5 years. And coming to the question that you asked about India becoming a product nation, right? I think the key that we sort of, at least my journey, in the last 9 years at Qure, I think what is required is that you need a lot of patience. When you start a services company, you can get to revenue faster, you can get to profitability faster. With product companies, you're taking a bet, and you may or may not succeed. And you need capital, you need patient capital that is willing to take that bet. And we were fortunate to have PeakXV on our cap table. They sort of took a bet on us back in 2020. And I think, and we were also talking about that earlier, Satish, that I think in India now we have that capital coming in. If you build it, people will come, right? And we are seeing that capital coming in. But I think that is I think the key requirement, that you need to have that capital that is willing to bet on founders who are building products rather than on companies that are working on services.
We're going to dig deeper into just a couple of aspects. Rajan, would love to have your perspectives on two things, right? So what is that biggest mind shift that we need to go through, and then the patient capital that's necessary? Because sometimes product companies, it takes 7 to 8 years, like what Prashant said, to get certifications and regulatory approvals and to be revenue ready, unlike services companies. So one is the mindset shift from an ecosystem perspective. Two is the patient capital. Love to hear your perspectives.
Yeah. So I think firstly, when we talk about products, I think it's important to keep in mind that we do have software product companies. They're not deep tech necessarily, but the first SaaS unicorn in India was 2018, Freshworks. Today we have about 27 of them, and I actually think we'll have 100 software product unicorns well before 2030, right? So we do, when we think about products, because the title of the session is products, I think products, deep tech, we are now talking about deep tech, right? So I just wanted to put that out there. I think the mindset shift is, look, we have to have more deeply technical founders, right? So, Prashant, I'm assuming you're technical, right? Yeah. So, as I say, it's very rare to have an MBA start a deep tech company, right? MBA needs a co-founder who's all deeply technical. So I think the first thing, mindset shift, is we'd love to see, just as a firm, I'd love to see many more academics. I'd like to see many more researchers in India really try to commercialize their innovations. I think that's number one. I think number two, look, we should be more audacious and ambitious. I'm tired of all these WhatsApp threads that go about comparing, saying we don't have enough deep tech. Well, just get off your bed. Go start a company. Stop complaining. Look, I think we should just stop complaining, right? Look, we have the talent, we have the markets. We just need the ambition and the aggression. So I'd say that have more technologists, more scientists, more researchers start companies. Second, stop whining. Think big, be ambitious, be bold, right? I think from a capital provider standpoint, Satish, as you know, we have a lot of capital in India today, but we don't have enough capital going into deep tech at every stage.
Correct.
Right? We don't have enough dollars going into research. We don't have enough dollars going into commercialization. We don't have enough venture dollars going into seed, Series A, B, C, and growth capital. So I think I do. And by the way, if you add it all up, India has about 0.65% of GDP on R&D.
Right.
US is at 3.5%. China is at about 3%, right? And if you look at the GDP, relative GDP difference, you're talking about hundreds of billions of dollars gap between us. Just Israel, by the way, with 8 million people, spends more on R&D on an absolute dollar basis than India does with 1.4 billion. So that is the gap, right? So I'd say we have a massive capital gap. So we have to address all of these things. But I think the good thing is, much like Mr. Agrawal was saying, if you had gone back 8 or 9 years, we could have never imagined a Mahakumbh at this scale. How many? There were 100 registered startups or something?
Just about 100.
Yeah. A few hundred, right?
2016, we had about 6,000.
Yeah, 6,000. Today we have 150,000.
168,000.
160. It keeps going up every day. So there you go, right? So I'd say that's what we need, Satish. But I think we're on our way. We just need to accelerate. We just need to go faster.
Yeah. Moving to Mr. Anil Agrawal, sir. If you really look at again, you talked about DPI, digital public infrastructure, and we have to build so many product startups. And today, given the geopolitical situation, the wars are fought based on, digital wars. These are not physical wars, right? So how does the country how do entrepreneurs go about building these products, whether it's mapping product, whether it is, something like commerce product, ONDC type of a platform. I know you have kind of supported some of these initiatives during your stint at DPIIT. So I would love to have you address that particular aspect of building product startups for the nation.
So I think if you look at some of the category defining startups that have come out from the government, probably ONDC would qualify to that category, right? That gives a different paradigm of doing e-commerce, and that is something that can be actually replicated across the world if they have the necessary rails along. Now, this is something that needs to be done at scale in India, and with the DPI implementation that we have, the kind of data that we have, we can have a whole lot of entrepreneurs build applications using AI with data on DPIs, looking into the open source architecture of e-commerce that ONDC provides. I have one particular suggestion to make here is, we must focus on our own languages, or when we are implementing applications. 90% of us do not understand English. 90% of India, 140 crore people, 90% of them don't understand English at all. So any app that you are building, it is only catering to less than 10% of the population. I'll give you one simple example. I went to a tier 2 city. From a hotel, I asked for a cab to go to the airport. When I got into the cab driver asked me, "Sir, कहाँ जाना है?" I said, आपने देखा होगा ना ऐप में मैंने कहाँ जाने का बोला है. सर वो अंग्रेजी में है, मुझे समझ में नहीं आया, आप बता दीजिए कहाँ जाना है. Now this is a real problem. We have not sorted out this issue. We are not building apps for tier 2 and tier 3. We are building apps only for those people who are good in English. And the entire bottom of the pyramid is being left out. Now imagine if this is one. Second is, even when we do translate things in Hindi, it is actually, verbatim translation of English words into Hindi, and it does not create to the cultural context. For example, in all e-commerce apps, you will ultimately have a final button as checkout, right? if you look at Hindi versions, many apps will say checkout in Hindi. But checkout is not understood by somebody who's from tier 2 and tier 3. Now, what I'm trying to say is, please have AI model. We are building Bhashini, we are building AI models for our own languages, but then it needs to be rooted into that language's cultural context. It's very important. You can't have something created in English and then you translate that into Hindi. It doesn't work out that way. It's a different thing. It's a different terminology altogether.
Right.
So that is something probably. And if you do this, probably you are enabling whole lot of entrepreneurs from that 90% of the population who reside in tier 2 and lower cities to empower them to dream of doing what we all of us are doing in this space.
So shifting gears, Prashant, how did you envision a global product? So how did you transform Qure, kind of not only addressing India and emerging markets, but also global opportunity?
So I think, for us, I think there was no choice but to be global. If you look at a B2B healthcare business in India, it's not a large enough market. So then you have to think about where else can you offer the same products. And when you're building AI products for the clinical space, anything in the pulmonology space, radiology space, neurology space, you're building it for everybody. The clinical pathways are the same across the world. So what we were building was for a specific clinical pathway. For example, a clinical pathway for detecting tuberculosis or a pathway for detecting lung cancer or stroke. And the protocols are pretty much the same across the world. So we just had to make some tweaks to deploy it in different geographies. But we basically were building for a doctor in, I think what we have done is the base technology is built for a clinician. But over time, what we've realized is how it is delivered is very different. If you're delivering in Africa, you have to deliver it in a different way. There is no internet connections. You have to make it sort of on the edge everywhere. In Africa, in the US, it's all in the cloud. In India, it's somewhere in between. So again, we have to figure out how to customize it for different geographies. But the base technology, AI technology remains pretty much the same.
Absolutely.
Right? Yeah. I think the other thing that sort of we realized about 2-3 years ago is that, I don't know how many of you have sat in a Waymo autonomous vehicle in San Francisco. And there have been these I remember sitting in an autonomous vehicle or basically in a Tesla in 2015 with a friend of mine in the Bay Area. And this guy basically put the location and this vehicle took him from his origin to destination automatically without him touching the steering wheel. This is back in 2015. But now autonomous vehicles are a reality in the Bay Area, right? So again, regulations change. And most importantly, what our learning has been that if you are building an autonomous vehicle, you're building for the passenger, not for the driver. And if you're building for the driver, the value is a little smaller. If you're building for the passenger, you're actually unlocking a lot more value. And so when we started offering our products, we started offering it to radiologists. The value to a radiologist is basically time saving. They're able to read a little bit faster. But when we realized that we could actually offer it to the end user of radiology, radiology information, right? This is basically a pulmonologist or a neurologist or a healthcare worker in Africa. There the value is phenomenal. We are able to now detect TB in seconds where it took weeks to detect TB, right? We are able to find a lot of lung cancer cases who were not diagnosed at all because the X-ray was not read on time, right? So there is a lot of opportunity, a lot of value that is unlocked if you go at the end user of radiology services. And that's again a learning that we sort of had as we looked at a global market for our product portfolio.
At NASSCOM as well is doing some great work around all of these aspects, talent depth, patient capital, industry, academia, collaboration, market access, exits, policy. So I think there's no better time than this for all of you out there to be a deep tech product entrepreneur. Thank you all. Appreciate it. Thank you.